Well, my name is Dr. Amit Patel. I grew up in a family of dentists. I'm a second-generation dentist, and I moved down here to Delaware 5 years ago. I've been practicing for 10 years. I was up in Pennsylvania before, and I changed the name of the office to American Dental Care when I took it over 5 years ago, just so that I could add my own personal flair to the office, my own motivation, and kind of my own expectations of how I'd like the office to be run and how we treat our patients. Invisalign is a newer method to treat crowding and other issues related to the movement and the positions of teeth. It involves using clear aligners that a patient will wear to move the teeth into the positions that we've planned for them, as an alternative to using metal wires and brackets to move the teeth.
You don't have to worry about like the sores in your mouth and all the extra metal. You don't have to worry about the brackets getting knocked off and things like that.
When I first got them, I did call my parents up, sister up, let them know that I got Invisalign. A couple of friends at work asked me what was on my teeth, did I have clear braces? And yes, I did. And it was all exciting. After 6 months into it, started seeing a little change, and it started coming together. So
it's easy for the patients to use. They do come in and out, so people are allowed to eat and drink whatever they want to, as far as their favorite meals go, sticky foods, things like that. They're easy to clean. They just need to be brushed basically whenever a patient brushes their own teeth, and they just pop them right back in again and wear them throughout the day.
A lot of times when I tell people I have Invisalign, they don't believe me because they don't see anything, and I can easily pop it out and show them. And when I take pictures, I'll say, "Oh, I'm wearing my braces." And they're like, "Where?" And I'm like, "They're on my teeth." But because they're clear, people don't notice.
I usually like to see a patient every 2 months while they're undergoing the Invisalign treatment. Those are our basically reevaluation visits, which are very easy. They're quick visits where a person will hop in, we'll just take a look at how the aligners are fitting, answer any questions that they might have or any concerns.
I come see Dr. Patel about every 8 weeks, and we see if I'm up to date on my trays. I'll admit sometimes I slack off and don't wear them like I'm supposed to, but it's easy to get right back on track.
Someone on the fence about making that decision between Invisalign and traditional braces would definitely benefit from coming in to at least have me take a look at them, do an assessment, and find out how long the treatment will take them. Give me the chance to kind of get a good model of their teeth on the computer so I can show them what our goal would be, and then give them a good idea of what it would cost as well, and then answer any other questions that might be specific to their teeth and what their desires are. And then they can use that information to go back to an orthodontist if they wish, to kind of compare the two options and see what would be right for them.
I would say go for it. I mean, it made my life a lot better. I mean, smile more, laugh more. I mean, just feel better about yourself.
If someone was on the fence about picking conventional braces versus Invisalign, I would tell them to definitely pick Invisalign. Perfect example, if a bracket were to pop off over the weekend, you're stuck with a piece of metal roaming around in your mouth that, the glue is stuck on your teeth. If something happens to your trays with Invisalign, you just revert back to the previous tray, call the next week, and you go from there. It's less hassle. You don't have to worry about stuff being in your teeth. Are you getting your picture taken? What's it going to look like? Are they going to be shining? I've had that happen before. It's just overall a lot better than conventional braces and a lot easier.
I would say Invisalign.